Hi guys, and welcome back. It's Hannah here from Blue Ferret Boarding, and every month, as you know, I like to talk about different themes. So this week I want to talk about some of the more common illnesses that affect ferrets and sadly which can shorten a ferret's life. However, I need to put the caveat in that I am not a vet, Blue Ferret Boarding is not a vet, and I'm telling you these for your general knowledge and understanding. I'm not telling you these for you to use to try and diagnose your own ferret. I will give you some of the symptoms, but it is up to you to take your ferret to the vet, and it's not necessarily on these symptoms that your ferret might show other symptoms. So please do not take this as gospel. This is simply for you to get a better understanding. Please take your ferret to the vet if you're in any doubt. That is always the response. If you are in doubt, nobody else, if you are in doubt, take your ferret to the vet. That's what they're there for. So with the lymphatic system, you might find that there's lumps and bumps, which is with the lymphatic nodes in different parts of your body and with your ferret's body that have enlarged, and quite often that's because of a tumour. Now, sometimes with a bit of illness, a lymphatic node might enlarge because it's helping to fight the infection. However, with lymphoma, there are actual tumours, and you will start finding that there's lots of lumps and bumps all over at the lymphatic nodes. There doesn't necessarily have to be just at the nodes though. There could be lumps and bumps all over the body. Again, you might find lethargy, there might be just general wastage, diarrhea, laboured breathing, because depending on where those tumours are, it can be pressing on the heart and the lungs, a loss of appetite, as you might imagine. Now, there's two types of lymphoma. There's what I think of as the normal lymphoma, which has a proper name, but there's also the juvenile lymphoma. And again, I'm very happy to say I've never had a ferret myself with the general lymphoma. However, we did lose a ferret from juvenile lymphoma, and it is very aggressive, very aggressive. With the general lymphomas, I think of the one that usually happens to older ferrets, there are things that can be done. So again, my point being, as I've always said, it's about knowing what your ferret's typically like and noticing changes, and on those changes you take them to the vets. So the next one is adrenal disease, and the adrenal glands sit very close to the kidneys, and this is where you generally get tumours in the glands. And because the adrenal glands produce a few different hormones that can control various different things within the body, that means that some of the actual symptoms can change depending on where these tumours are and quite how they're affecting it. Again, ferrets can live for a long time with these, so it's not a death sentence necessarily, but again, it is worth being aware of the symptoms, which for adrenal, a good symptom of adrenal is when you start to get hair loss on the back, sort of around the kidney area, on the buttocks, higher up, that lower back area, or on the buttocks. And usually it's on both sides, symmetrical. Now, for a lot of people, they see a rat's tail on their ferret and they think, oh my God, my ferret's got adrenal. If your ferret just has a ratty tail and it's within the molting season when things change, I would say, don't worry too much, it's probably just a ratty tail. If you're in doubt, go to your vets. The final one of these big three, as it were, is insulinoma. And I always think of that as the direct opposite of diabetes. So insulinoma is again very prevalent cancer in ferrets, and that's when you get tumours in the pancreatic, or in the pancreas or in the pancreatic cells. And these tumours can create an overproduction of insulin, which causes this massive drop in sugar levels. Now that, a few weeks ago, last week when we were talking about first aid, and I mentioned seizures then. So quite often, if you've got a seizure, if you've got a ferret with an insulinoma, it's possible that will start presenting with a seizure, or it could be, if you are aware and your vet is aware of your ferret having insulinoma, it could be that it gets seizures. as part of that. Quite often with insulinoma, it's about managing that ferret's blood sugar, but rather than there being too much sugar in the blood, it's that there's not enough, which is when we start rubbing a little bit of honey or a little bit of glucose syrup or something similar on the gums, just a small amount, and the gums are a good way for the ferret to absorb that sugar into its blood system quickly. Some symptoms of insulinoma are also a lot of salivation, pawing at the mouth, this idea of being dazed or confused, not quite sure what's going on, tremors and seizures. So often it's to do with low blood. So if you think of low blood sugar, the fact that you can shake, that you're a bit unsure of things, and it's the same for your ferret. So again, as I've always said, know your ferret, and if anything changes, take them to the vet. Okay, so the last ones are pyometria and anemia, which I kind of put together because, as it might suggest, pyometria is an infection of the uterus, so it's only female ferrets, and it's only female ferrets that still have their uterus. Now, as I've mentioned in previous videos, ferrets are an animal that work on induced ovulation, which means that a ferret can come into season, and the only way they come out of season is through being, the ovulation will bring them out of season, and that can only be induced through one of a few ways, which means that your female ferret, if she's not mated or if she's not been jabbed or whatever, she will carry on staying in season kind of forever, but not forever, because what will happen is that ferret in season is then very, very prone to infections in her uterus, and she's also prone to an anemia because of what being in season is. It means there's a lot of blood moving through, and then she is starting to become anemic herself. And so pyometria and anemia can be sadly very common and can be fatal for female ferrets, and yes, I have seen it. Okay, finally, chordomas. Chordomas are kind of a misprogramming almost of some of the cells in the body, and they tend to happen at the end of the tail, and it's a kind of a bony growth, and it almost looks like a hammer tail, like a mace on the end of the tail. And again, it's not necessarily deadly at all, as long as you keep an eye on them and know at what point they need to be looked at. And again, go to your vet, because you're not going to know entirely. You're going to ask your vet, and it's your vet that's going to give you the advice. So that's pretty much for this week. It's been a bit of a serious one, it's a sad one, but overall I really hope that you've got my message of, if in doubt, take it to the vets. That's what they're there for. Nobody else but a vet is going to know enough, no matter what. So I'll see you next week. Until then, take care.